Welcome to another episode of Clean Talk. I'm your host, Brad Whitchurch. It's Wednesday at 3 p.m. Eastern Time, and that means we're coming to you live from our studios in Seal Shield here in beautiful downtown Orlando, Florida. Very pleased to have with us on the show today my special guest, Chad Neilsen. Chad is Director of Accreditation and Infection Prevention at UF Health in Jacksonville, Florida, and he's the Public Health Officer for the Florida Air National Guard. Chad, welcome to Clean Talk.
Yeah, thanks for having me, Brad. I appreciate it.
Well, we really appreciate having you on the show, and I know we've got a lot to talk about today, but what can you tell our viewers about yourself and why you're on Clean Talk today?
Well, I'm very fortunate to be able to share some of my story and tips and how we've gotten through this pandemic and other issues throughout my career. But I've had a very colorful career. I didn't start as an infection preventionist. I started as really a marine biologist back in college. And so I've had a very interesting career track that I think a lot of people can look at and take some advice from or even just take interest in and realize that you don't always start in a certain place where you think you're going to finish. So.
Well, that's right. And we'll dive into that a little bit. But looking at your bio, Chad, I think we might be brothers from another mother. We have a lot in common. We're both Florida natives. We both went to school in Orlando. We both live in Jacksonville with our families and both very passionate about infection prevention and infection control. So really appreciate you being on the show today. And really curious to find out, you talked about how you kind of had a change of career paths to get into epidemiology and infection control. And this sounds a little strange, but I have a note here that it has something to do with turtles. Can you tell us about that?
Yeah. So back at UCF, where I was doing my undergrad, I was a biology major and then got involved in the UCF Marine Turtle Research Program. So I thought marine biology was going to be a great path for me. And so indeed, I started doing sea turtle research out in the beautiful Brevard County region of the state. But what we ended up seeing while we're measuring and doing workups on turtles was these turtles started washing ashore with different types of viral tumors. And so when I asked the grad students who were sort of supervising, hey, what is this? They said, well, you should take an epidemiology class. You'll see how diseases move throughout populations. Well, I did that and then really fell in love with epidemiology. And so that led me very naturally into infectious disease control and prevention. And it all really happened because of some sea turtles washing up in Melbourne Beach, Florida.
That's very interesting. What is the parallel, if any, between epidemiology for sea turtles and epidemiology for you and me?
Probably the fact that humans are much more difficult to get to do anything than a sea turtle. I think we have feelings and personalities and social circles and all these things that are not good for people like me to control outbreaks or infections, whereas the sea turtles are a little more straightforward. And they're covered in salt water all the time, which we know is a very powerful cleaner of wounds and organisms.
Interesting. Well, I know that you're part of the Florida Air National Guard. Thank you for your service. Sure. And I know that you've had some experience related to infection prevention in your role with the Florida Air National Guard. And you were involved in the 2014 Ebola breakout. What can you tell us about that experience?
Yeah, so at the time I was working with the Air Force Reserve Command, and I was one of the few epidemiologists that they had on the payroll at the time. And so we started sending different Air Force, Navy members over to Africa to assist with these Ebola patients and the outbreaks going on across that continent. And so my role with the reserves was essentially to get the bases across the United States ready to potentially receive either infected or suspected cases who needed an advanced level of care. So, my job was really calling literally 65 reserve bases all over the world from Guam to Alaska to ask them and check off what kind of PPE they had, what kind of disinfection solutions and wipes they had, and also just what to do if somebody shows up on one of the cargo planes and has suspected Ebola. And that was pretty challenging, working across 10 different time changes across the world and trying to get people who don't even know what Ebola is to understand how to clean the back of a C-17 aircraft. It was very challenging, but luckily we got the resources we needed across the Air Force Reserve bases, and we were able to avoid any disasters.
Well, Ebola, a horrific pandemic, and really probably not a lot of coverage in the mainstream media, and it certainly didn't have a significant effect on public health here in the U.S. But I imagine that experience helped to prepare you for the COVID pandemic, which has deeply affected everyone in the world. Can you tell us a little bit about that? I mean, did your experience with Ebola help to prepare you at the onset of COVID within the healthcare system and your role with the Air National Guard?
Yeah, I definitely think the Ebola outbreaks were a good training exercise for what would become something much more real for us. I know we had a couple of Ebola cases here in the United States with advanced treatment, but nothing to the extent that COVID-19 has caused. And so after the Ebola outbreak and in the couple of years ensuing after, we built up PPE levels for both the Florida and the Air Force and the Air National Guard, but as long as our hospital too. We stockpiled N95s and biohazard suits and different forms of PPE because we knew that our previous plans were probably inadequate. So we ripped up all of our previous plans and policies, both with the Air National Guard as well as the hospital system, and rewrote them to be more broad and contain more usage of PPE. So in that sense, we were much better prepared.
Well, we talked about it a little bit earlier, and I'd love to dive into it. Some of the other technologies that have either emerged or become more widespread within the healthcare system as a result of COVID. You talked about ramping up the PPE. What else are you seeing in your healthcare system or in other healthcare systems? Are there any best practices you can share with our audience?
Yeah, well, I definitely think that certain technologies have taken off just previous to the pandemic, but especially after. One of those is UV technology. So we've long been using UV robots, so to speak, to disinfect rooms. But the advent of that technology and the amount of money that it's dropped in price has now allowed us to use it for everything from disinfecting the air that comes to our air handlers, to cleaning patient rooms, to being able to disinfect our devices on our desk every day, whether that's an iPad or a phone or whatever. So that's one technology that I think really took off prior and into the pandemic that I think is really useful, and there's a lot of evidence for. And then I think in general, what we've also seen is a more focused look at how do we clean our environment. So water in particular, CMS changed some of the rules to mandate that all hospitals have water management plans, and then Joint Commission or DNV enforce those rules. And so using things like copper and silver ions to disinfect your water, hyperchlorination of water, things of that nature have really come a long way in the last 10 years or so, and particularly during this pandemic, to be able to clean our environment of care in a way that we never were able to before.
So metallic ionization, antimicrobial for the water, UV disinfection for whole rooms, for air handling, and for devices. We have also seen the proliferation of UV devices, and I think I told you earlier, we've seen a lot of COVID-specific applications, kind of off-label, UV light being used to disinfect N95 masks so that they can be reused. And the NIST just came out with a study validating UV light for disinfecting those masks. And you never heard about this pre-pandemic. So I think, if there's a silver lining, we are seeing the emergence of newer technology. Let's talk about hand washing hygiene. Isn't that what's really important?
Yeah.
So have you guys been driving as a result of COVID, increased hand hygiene, or have you seen increased hand hygiene kind of naturally occur with practitioners because they have the awareness? What are you guys doing with hand hygiene?
So we definitely saw a natural bump in our hand hygiene compliance numbers as well as PPE. I think when healthcare workers found out that there's this unknown virus rotating through the world and into our hospital system, it just drove natural compliance through the roof. That being the case, we had to respond to that demand in products. So we attempted to increase our number of dispensers, putting dispensers in places we might not have before, just giving the staff more options to be able to clean their hands, whether that was with water buffalo sinks and sort of mobile sinks on units, or putting alcohol hand sanitizer in Bacardi bottles and dropping it off at the nursing station with a label that says "Don't drink." But we certainly faced that supply chain demand as well, that we had to get creative. And fortunately, we had a lot of good partners in the Jacksonville metro area that could provide us some alcohol sanitizer to keep up with that demand that the staff had.
You mentioned CMS and you mentioned the Joint Commission. Can you tell our audience, what is the Joint Commission? What is CMS? What is their role? And why is it important that the healthcare system is interfacing?
Yeah, so to start off, CMS is obviously Medicare, Medicaid, and they're the ones who fund most hospitals through their insurance plans. And so CMS, as a factor of trying to keep hospitals honest and safe, they mandate that hospitals hire one of several accreditation organizations to do their surveys. And so our hospital is with Joint Commission, but there's also DNB and Premier, and there's some other corporations that do these inspections on behalf of CMS. But these companies like Joint Commission, their sole focus is trying to increase patient safety, right? That's the name of the game. That's why we do infection prevention. And so in doing that, there's literally hundreds of standards that hospitals must follow from your accreditation agency to ensure that you have a safe environment. And then every 3 years, they actually come in person, as they did with our organization in December, to check up and see whether or not we're following those standards. And fortunately, our hospital did really well because we went through that triennial survey. We didn't have any serious findings that caused a revisit, and we were very grateful for that.
And because you're in charge of the accreditation, right? Made sure it all worked out just fine.
Yeah, that's right.
But that is your role, right? So you interface with Joint Commission when they come in to do an audit or an inspection, and then what, they give you a clean bill of health and you go on with business as usual. And
yeah, essentially. But my accreditation manager who works for me probably says, no, you're underselling it. But yeah, so they come in, we coordinate the survey with a lot of our clinical partners across the hospital. We immediately get notification of how we did, good, bad, or ugly. And then we do have standards that we have to meet afterwards. So although we got away with no serious findings, we still had action plans that we had to set up to handle some of the more minor findings. We submit those, and then Joint Commission reaccredits us for another 3-year cycle. But it's a huge process, and one that, with my unique role being both over accreditation and infection prevention, it just made a lot of sense to involve my infection preventionists in this process, because the number one reason that Joint Commission will cite a hospital for a revisit is infection prevention reasons. And we were able to really utilize our IP staff in doing best practices and avoid a revisit.
So the buck stops here.
Yeah, that's right.
So Joint Commission making sure that healthcare is safe, highest levels of patient safety. I think we've all become aware of the public health impact from these pandemics, but something we don't hear a whole lot about that I'm conscious of is the potential for these pathogens to be used for bioterrorism. And those of us in the industry know that this is a serious and a valid risk. Why don't we hear more about this in the public? And do you agree? I mean, is bioterrorism something that we should be concerned about?
Yes, absolutely. You don't hear a lot about it in public because I think there's a scare factor associated with the idea that, Ebola is going to be strapped to a bomb and set off over San Francisco or something. But it is a real threat. We know that chemical and biological weapons exist. You're seeing and starting to hear a lot of that in the news right now with the really unfortunate, events in Ukraine. So it is a very real potential threat. Here in the United States, the military, as well as the Department of Homeland Security, run a program called BioWatch, and it's non-classified. You can read about it online. And this BioWatch program is really a partnership between health departments across the United States, the military, the FBI, and Department of Homeland Security to basically set up listening stations, so to speak, that routinely check air in every major city in the United States, with the point that it can detect a potential bioterrorism threat if released through the air. You also have robust bioterrorism policies and safety policies at not only health departments, but utility companies across the United States, right? One of the main concerns that we would have is that not necessarily air, but somebody could contaminate a water source and reach millions of people across a metro area. So you see a great deal of security and policy surrounding utility companies, water sourcing companies, and such to ensure that we don't have another sort of anthrax level event like we saw in Florida back in the 90s.
Yeah. So, and actually, that anthrax event also a catalyst for a lot of the technology, PCO technology, for example. A lot of the air technology that we're seeing being used today with COVID really initially came about from that SARS scare. Well, I know that you have experience both in the healthcare system and with bioterrorism and bioterrorism strategy. I understand that you consulted with the state of Florida and the governor's office on the COVID response. What can you tell us about that?
Yeah, so very shortly after the pandemic sort of touched our shores here in Florida, the Florida Air National Guard actually called me up. They put me on orders. And after a brief tour of Florida, helping to set up those mega testing sites that many people heard about or read about, they sent me to the Florida Department of Health and the Emergency Operations Center at our state's capital in Tallahassee to basically serve as a subject matter expert, not only for the Florida National Guard, but also for the state surgeon general. And so I had a nice interface in between sort of the military, the helping arm of the National Guard, and the state surgeon general and the Florida Department of Health's office on, how to strategize, how to send things, PPE or other supplies, what we were doing right, what we were doing wrong, and really that early part of the pandemic, it was a very important time for us at the Emergency Operations Center to get things moving, particularly in our protection of long-term care facilities and nursing home residents.
Now, I understand you're taking a scientific approach to this and that you've been looking at genetic sequencing for traceability, right? Can you talk a little bit about that?
Yeah, one of the cool things that's been happening in infection prevention and hospital epi for several years now and really taking hold during the pandemic is using whole genome sequencing to essentially track, trace, and ultimately prevent outbreaks. So we used to use typical epidemiological methods to sort of say, yeah, we've got an outbreak on this floor of MRSA, right? The rooms were next to each other. They shared the same doctor. They're probably related cases. Well, today we have better technology, so we don't have to say they're probably related. We can actually take those samples from those patients, match them against each other with some genetic sequencing and see, did we literally have transmission of one organism to another? And that's been really helpful for us. We used it several times to rule out COVID outbreaks here within our own hospital and our hospital system, and also for other epidemiologic purposes. It's been a really useful tool and also a technology, this genome sequencing that's reduced in price greatly over the last 10 years, and it's made it accessible for everyone.
Well, certainly effective at helping with traceability, but isn't the solution the same? What is the outcome, right?
Yeah.
You're vaccinated or you're not vaccinated. What do you recommend to people that are unfortunately exposed to COVID and having severe effects from COVID?
Yeah, I mean, first, number one, let's try and prevent it, right? We know that vaccinations, particularly with the ones that are approved by the FDA, are the number one way to prevent serious COVID illness and death, period. That's without a doubt. We've literally vaccinated millions and millions of people in the United States and even here in Florida. We know that vaccines work for this to keep you out of the hospital and alive. But beyond that, following the booster schedule, as folks should, has allowed us to get back to normal here, not just in Florida, but in the United States. Largely, the pandemic is waning. You will still see hotspots here and there, but vaccines, washing your hands, and taking care of yourself by not showing up to work sick, not sending your kid to school sick. Those bread and butter ideas of epidemiology over time are exactly what is our ticket to get out of this pandemic, and it's been working so far.
Old school common sense, right?
That's
Go
right.
back to basics. What else can we do different? So you mentioned that there's new technologies that you're implementing into the healthcare system. You talked about metal ions for water purification. We talked about UVC disinfection and driving hand washing hygiene, more PPE. What are we missing? Is there something else we should be looking at?
Well, I certainly think the common factor behind all of this is people, right? We need people to do a lot of these things. And so, there's a whole field of human factor engineering, which we use a lot when we talk about performance improvement and Lean Six Sigma. We need people to do these things. And so, how do we work our infection prevention interventions into a workflow of a nurse or a tech working with patients to allow them to do what we need them to do to protect themselves and the patient? I think that's really the thing that infection prevention has probably been missing for a long time, is that common sense of, yes, we know that a nurse needs to wear PPE and wash his or her hands and do all this. How do we make it really easy for them so that they can't miss it and it's not an impediment to their workflow? We all know there's a healthcare staffing crisis right now in our country. There's not enough nurses, particularly here in Florida with an aging population. So asking them to do more is a problem. It's going to interrupt their workflow and make it harder to do their jobs. And so how do we as infection preventionists make their jobs easier and still allow them to do the right thing? I think that's the big coming flood of infection prevention methods in education.
Well, speaking of education, I know you're involved with UF Health.
Mhm.
Are there any changes that you see coming about in the education process, the way we're preparing healthcare workers as a result of COVID?
Yeah, absolutely. I think one of the things you're seeing a lot of these days, and something we're actually going to be working on here, is augmenting our traditional education methods with virtual reality and AI. So, for instance, we are soon to be doing a trial using augmented and virtual reality to teach staff how to do appropriate central line dressings. And so you might think, well, why would you need that? Well, we can actually do it on a virtual mannequin with any number of body habitus or different types of conditions to allow a nurse to see these different conditions without actually having to do it on a patient. So this is something the military has been utilizing for a long time, right? Because we can't just, put live action grenades in front of everyone and say, here's how you throw it or run. So we've been using virtual reality type methods on the military side for a long time, and it's finally starting to work not only into the hospital, but into infection prevention departments. And I think it's going to provide a really useful tool that's going to be able to expand our ability to educate in a more realistic fashion.
Well, I agree. I had the benefit of getting to see some of this next generation VR technology at some of the recent healthcare shows we've been attending, both at HIMSS and the AORN show. And from my perspective, when you're walking up to this, it's like, this is just what a gimmick. But when you actually try, it is amazing. I mean, you can do anything, right? Like you said, you're there, but you're not there. And for training purposes, just incredible technology that's hitting the mainstream marketplace right now.
Yeah. Really exciting stuff. We've been using it for our trauma department because we do have a level 1 trauma here, one of the best in the Southeast, we believe. And we've been using it for trauma for quite a while with simulated mannequins and mannequins that walk and talk and do different things to simulate care. But moving that into the infection prevention realm is a totally new chapter for us in our field, which we're really excited about.
Yeah, I saw they had a game set up where you were using the virtual system and it was a competition for less cross-contamination and following the right procedures to make sure that, and I just thought it was incredible. So really excited about that technology as well. What else do you see coming for infection prevention? Any predictions for the future?
Yeah, more work, less people. I think as is healthcare, I think the infection prevention, field in general has really, to put it mildly, benefited from this pandemic. It has put us in the spotlight. We used to look back at that movie Contagion with Matt Damon and think, well, yeah, that's how people know us, or Dustin Hoffman in Outbreak for some of our older watchers. But it really has shone the light on our field. And I think with that, is going to become more responsibility for infection preventionists moving forward. Hospitals know, and communities and health departments, they know what we're capable of now. And so I think that they're going to expand us. They're going to expand our usage. They're going to put us in non-traditional roles, like on every cruise ship that goes out to sea, you're going to have an infection control officer. Disney, movie companies, they were hiring infection control staff. So the field has really exploded over the last 2 years, which is a good thing for us. We just have to ensure that our staffing and our pool of talent continues to remain very strong, because there will be a demand for us in the future, and we have to keep pushing things further with education, with our knowledge and our abilities to keep up with this demand that's newly found.
Well, I tell you, I think that's a fascinating perspective. My experience is that the cruise lines have always been serious about this. They
Yes.
really have. But you talk about other vertical markets. I mean, the movie theaters and just going out to the restaurant. If you're a big restaurant chain, this is something you better have a strategy around now, right? We never thought about that before.
Yeah, absolutely. And certainly they didn't have strategies. That's why, our hospital and others and people like me became, freelance consultants as a side job in its entirety during this pandemic. I had HOAs, homeowners associations asking me, hey, do I need to shut my pool down? We have nobody who can give us this answer. And so we had this huge amount of interest in our department, helping schools when the DOH couldn't help them, the Department of Health, helping, homeowners associations, businesses, children's, daycares. This whole idea of how do we prevent infections was totally foreign to most of the world, really, until this pandemic. And then we became very important commodities in that. And so I think a lot of people in the field took advantage of that with consulting jobs or whatnot. But I don't think that need is necessarily going to go anywhere. We always say we're only one respiratory virus or organism away from another pandemic. And that holds true today as much as it did 10 years ago.
Well, I know you've been a governmental expert advisor. Any predictions for what might change with the government's role as it deals with post-pandemic society, whether it's in healthcare or in the general for the general public health? Any predictions there?
Yeah, I certainly think that we know better how to prepare for the next one, so to speak, right? We thought we were prepared after Ebola, right? Money was dumped into the National Strategic Stockpile, and we did all this work. And then we realized we didn't really do enough. It was kind of just for play. I think now, from a federal perspective, we know a lot better now how to prepare ourselves. I don't think that we'll repeat a lot of those mistakes we made after Ebola. We're going to have our stock. It's going to be checked. We're going to have these partnerships and contracts already in place to quickly ramp up, PPE production, or medication production. A lot of those things that we saw from supply chain bottlenecks overseas when they were, China or these countries were providing our stuff and not able to get it to us. We won't let that happen again. We've brought a lot of these manufacturing jobs back over to the US, and we're replenishing in a way that actually will make a dent in the next pandemic. So I definitely think that we'll be better prepared, and we have better contracts and better manufacturing abilities than we did before this pandemic. And I think that'll continue moving forward.
Yeah, I agree. And we're seeing some fundamental changes in a lot of businesses. We used to all be Six Sigma lean. And now if you're Six Sigma lean, you might be out of stock for quite some time, right?
Yeah.
So we all have had to change our business model, increase inventories to address the supply chain issues. And I imagine that will persist for some time to come.
Yeah, absolutely. I mean, you're seeing it again right now. Shanghai is in a total lockdown as we speak, and that's having supply chain bottlenecks coming down the pipeline. So, it's just the new world we live in right now with different policies and different governments. And so we have to be flexible, and we have to ensure that we don't get sort of caught out in the wind again like we did when the pandemic started.
Absolutely. Well, Chad, in closing, any last thoughts for our audience? Any special words of wisdom around infection prevention?
Yeah, I think the one thing I will say is I've learned a lot over this pandemic. Probably two things that I think are really important for these IPs out there to hear. Number one, take care of yourself. I think during this pandemic, healthcare staff in general really have been leaned on a lot. And so, we can't be effective at our jobs if we're not taking care of ourselves and our families. I think that's very important. That self-care, right? Put the mask on yourself before you help your fellow passenger. And then second, borrowing from my accreditation standpoint, if you're not involved with your accreditation program as infection preventionists, you should be. Joint Commission and the rest of the accrediting organizations really rely on infection prevention as a cornerstone of their surveys. And so by marrying up the accreditation and infection prevention departments, or at least the staff, you're going to save yourself a lot of trouble and a lot of heartache after Joint Commission if you get it in place before they show up. So.
That's great advice, and that's the last word. Our guest today has been Chad Neilsen. Chad, thank you so much for being on Clean Talk today. Be sure to join us next week at 3 p.m. Eastern Time on Wednesday for another episode of Clean Talk, or go to cleantalk.tv and register and catch up on our episodes. Chad, thank you so much for being on the show today. Until next time, remember, keep it clean.